Hi, my name is Steve Jones. I'm the president of University Hospital's Geauga Medical Center. As the president of the hospital, I'm responsible for the overall management and operations, and I work very closely with our community and trying to work collaboratively in developing services that meet the needs of this community here in Geauga and the surrounding counties.
Hi, my name is Peggy Kuhart, and I'm the Chief Nursing Officer at University Hospital's Geauga Medical Center.
My name is Rick Kellerman, and I'm the Nurse Manager for the Emergency Department at UH Geauga Medical Center.
My name is Laura Ridgely, and I am the Pediatric Nurse Practitioner for University Hospital's Geauga Medical Center. My role as the Pediatric Nurse Practitioner is important in the emergency room because they get specified care just for them. A lot of people think that children are just small adults, and that is not the case at all. They have specific injuries and illnesses that pertain just to them that adults don't necessarily have happen to them.
My role in getting ready for the Emergency Preparedness program through the state of Ohio was to assure we met all their standards that they provided us in a checklist to give us a guideline to assure we were ready for their visit. We compiled a manual for the department and provided them information related to our practices, our policies, our procedures, and the training that we offer our staff.
I think what's important is that the community knows that we are pediatric prepared. The community has to understand that they can bring their children to this hospital and have the best, the highest level of care. And what we have noticed is that our volume has increased. They now know that we have an emergency department, that the physicians, the nurses, everyone involved with the care understands who that child is and what they need when they come to our emergency department.
When we provided training to our staff, we also assured that we provided education to our EMS community. We are control for 20 communities within our county, since we are the only hospital, and our physicians are very dedicated to providing that education on pediatric care, specific to medication dosing, pediatric safety, related to equipment needed. Our pediatric nurse practitioner also helps provide the education to our EMS community because it's very important that they have that knowledge because they're the first on the scene.
Well, it's important to have the equipment that fits their needs because it's specifically for their sizes. We have different size blood pressure cuffs, and we have pediatric specific monitor leads, smaller patches so that we can get better conduction on the chest to see heart rhythms and rates. We have specific equipment as far as respiratory-wise, specific nasal cannulas to deliver oxygen, and specific masks for aerosol treatments that fit the pediatric face.
We had already partnered with Rainbow's Babies and Children's, which is our pediatric hospital within our health system, and we were surveyed by them several times to make sure we met their standards of care. So this was a natural next step to seek state certification to provide our community, the sound mind of knowing we were prepared to take care of their children.
All of our children are weighed when they get here or as soon as possible so that medications can be done according to their weight. You can't just give a patient 650 milligrams of Tylenol when they are only 10 kilograms. We make sure that their medications are weight-based dosing so that they're getting the appropriate amount.
I think what's important, anytime you develop a standard of care, there's an opportunity where every area where you touch a child within your hospital benefits from the standards of care you change in your emergency department. So whenever we change something in our emergency department, we assure that it happens everywhere within our hospital. So it's been a great opportunity for us to assess the need and then put in a plan based on the EMSCP's regulations and then the verification piece.
As an organization where we always are looking at opportunities to improve quality and reduce costs. And no, it was not an expensive process. It actually was more about just being organized and educating our clinicians, our physicians, our nursing staff, and the entire organization on how to better care for pediatrics here at University Hospital's Geauga Medical Center.
To be the first recognized hospital in the Geauga County to be pediatric prepared is very overwhelming. It's a great honor to know that we can take care of the pediatric patient and that their children are safe with us, that we can do everything that we can for them, and to be recognized by the state as being able to do that as well is a great honor.
The message I would give to other healthcare providers and other hospitals throughout Ohio is really to consider this, as this would be an opportunity for you to analyze and assess your own emergency departments and hospitals for the highest level of pediatric care.
I would encourage all hospitals in Ohio to obtain this accreditation. It's a sign, it's a symbol, but more importantly, it's the quality of care that is provided to the communities, especially our pediatrics within our community. And for your medical staff, it gives them the confidence to refer their patients, our patients, to your emergency departments to receive top-notch care.